So this PowerPoint talking about the SOAP note. So SOAP note can describe as a method used to document a patient data normally used by the healthcare provider, right? So SOAP note, it is stand for S subjective, O stand for objective, A stand for analysis or assessment, and P stand for plan. So keep it note, the SOAP note are the way for nurses to organize information about the patient. And SOAP note, as I told you, stand for subjective, objective, assessment, and plan. And nurse make the note for each of these elements in order to provide the clear information to other healthcare professional. Uh, this note is widely used in medical or healthcare industry. The doctor, the nurses used the SOAP note to document and also record the patient condition and status. The SOAP note is considered as the most effective and standard documentation used in the healthcare industry, along with the progress note. First of all, what is chief complaint? Means why my patient is looking for the doctor care today. Chief complaint always patient's own statement. Like patient said, I came for pain, or I have a fever. Ask the patient why he or she looking for the care. And we do not rephrase what patient said. We should keep the patient's statement as what they said. Example, the correct, I have had a runny nose and sore throat for 3 days. The incorrect patient state that he has experienced the pharyngitis or discharge from the nose for 3 days. It is, you do not change it. Now, history taking, comprehensive health history and focused health history. Comprehensive health history must include the chief complaint, history of present illness, shortly called HPI, past medical history, family history, social history, and review of the system. And focus health history means identifying the data. Then chief complaint, history of present illness, data from the patient's past medical history, family history, social history, and that are part and to the chief complaint or problem oriented review of the system. Here we go and little bit more explanation about the history of present illness. The goal in obtaining history of present illness is to get a comprehensive description of the characteristics and progression of systems for which the patient look for the care. The different points included in history of present illness is a way to remember PQRST. And P stands for precipitating factor of the disease. Q stands for quality. R stand for radiation, A stand for severity, and T for timing. Example, a patient got hospitalized or admitted to hospital because of pain. We need to figure out the severity of pain or intensity of pain. Is it moderate, severe, or mild? So also differentiate what kind of pain it is. Is it neuropathic? Is it visceral pain or somatic pain? If patient said, if you say the pain is somatic, it should be dull, ache, or throbbing, sore. Visceral pain usually cramping or distension, and neuropathic pain, burning, tingling, numbness, and radiate. Very common character pain. So also it is important to evaluate long-lasting discomfort with the episode exacerbation that may be felt in the back or one or more joints or pelvis or other part of the body. Pain that lasts more than 3 to 6 months we call this chronic pain. And pain that lasts for more than a month or longer than usual or expected cause of the illness, also called the chronic pain. So then go another way to remember CLIENT, client. C stands for character of the pain. As I told you, is it burning pain? Is it active pain, throbbing pain? Location, where it is? In epigastric region. If it is pain in left upper part of the chest, it might be heart origin. If pain in the mid of the abdomen, it may be stomach origin or pancreas origin or gallbladder origin. If pain in the right upper quadrant, maybe liver origin. If pain in the right lower abdomen, maybe appendicitis or appendix origin, or any case of female, any female organ related. If pain in the left lower quadrant, maybe pain origin from the terminal part of the gut or the other organ related. If pain in the left or right lower area or trunk area, maybe it is kidney origin. So location is important. Impact, expectations, negligence, or timing. When pain come and when pain go. Outcomes. OUTCOMES. O for other symptoms. U stand for underlying, understanding or belief. T stand for treatment. Patient, you ask, if pain, did you take any kind of medication and pain go away after medicine? Complementary alternative medication, right? Like herbal medicine, Chinese medicine, any other options, modulating factors, exposure, and any spiritualities. The past medical history, patient define of the heart and perceptions of current health status. So you should ask the patient, evaluate any kind of past medical history or surgical history, childhood illness, major adult illness, any kind of allergies to environment, dust, pollen, any allergy to drugs like penicillin, sulfur, any medication, injuries, any history of hospitalizations, transfusion, blood transfusion, plasma transfusion, immunization is updated or not, any kind of a skinning exam, it is related to the patient age, any kind of psychiatric or mental health. Next, family history. So patient's major illness or health status of relatives. We have to ask about the patient father's side, mother's side. If patient say my father had a high blood pressure or diabetic, chance to develop the patient have high blood pressure or diabetes. It is important to evaluate. Same side, we will ask about the mother. She is alive or passed away, or what any kind of disease, or she's absolutely okay. So any kind of genetic defect in father side, mother side, also the sibling, also death or ethnicity. Some of the disease is most common in some particular groups. Social history include personal data, occupation, because some of the disease related to the occupation. Like a patient who worked in the pharma field as a farmer, they have a chance to develop the lung infection or farmer lungs. Housing, safety, socio-economical status, right? So the people if in live in a small area, so many people's chance to develop contaminated disease like tuberculosis, impetigo, diet, what kind of food habit is if the patient take too much uh, lipid containing food, chance to develop atherosclerosis, right? We have to evaluate exercise, sleep pattern, also sexual history. Is it homosexual, heterosexual, or active or inactive? Any kind of drugs or alcohol abuse, social support, stress, and anger management. Because stress is a silent killer, can cause so many diseases. Also, recreations or travel, right? Cultural belief, spiritualities, and even military services. Subjective. So, if you want to assessment a patient, always we need the history taking, or we need to gather all subjective data. Subjective data also we can call history taken from the patient. History of present illness includes symptoms, dimensions, chronological narratives of the patient complaint, right? Which is the most important that will be should be first, then next. Information obtaining from other sources, right? Always identify the source, if not the patient. Sometimes patients do not able to talk. You take the history from the patient relatives, attendants, secondary data. Also, pertinent past medical history, pertinent review of the systems. All system we will go one by one. For example, patient has not had any stiffness or loss of motion of other joints. We should evaluate current medication, right? So in case subjective data, they say, so assessment is the first priority. Because of assessment, we need subjective data. So assessment or collect the data is done primarily by RN. But the LPN must understand this process because LPN collect data as well. A critical role is assessment, always done by RN. There are type of data be collected. I said history taking, objective data means what you observe, what is measurable, like vital sign. Subjective data means symptoms experienced by the client. Maybe patients say, my throat is painful. So throat, it is subjective data. But blood pressure is a objective data. And data collected from the chart as well, right? So then go for review of the systems. The last component of health history is a review of systems. We have to review head to toe or system by systems like cardiovascular system, respiratory systems, locomotion systems, nervous systems, um, urinary systems, reproductive systems, all. The clinician questions the patients about whether or not she or he has experienced any symptoms that may indicate possible pathology in one or more body systems. So if patient calls about, I have a chest pain in the left side, I'm feeling something heavy, stone over my chest. It is most um, underlying cause patient has a heart problem, but it does not mean you only check the cardiovascular system and you do not check the respiratory system. You have to give more focus in cardiovascular system because patient complain related to the cardiovascular system, but the other system you have to examine, review one by one. So the nature and depth of the questionnaires are determined by the reason for which the patient is looking for care, means chief complaint. So if patient asks, I have a fever, then you should ask question related to the fever. If patient said, I have a pain, you have to ask question related to the pain. So you ask a question about the pain, the next question asks about the diarrhea or constipation. It is not a professional way to asking that question. How you collect the data is depends upon what kind of leading question you asking. Is it relevant or irrelevant? As well as the severity of the conditions if she or he present with an acute problem. Type of review of the systems, comprehensive review of the systems when a patient present for general health maintenance, disease preventive care, or focus the review of the systems when a patient present a specific chief complaint. Component of a comprehensive review of the systems include general, skin, eyes, ear, nose, mouth, cardiovascular, respiratory, gastrointestinal, genitourinary. In breast, men and female both need to evaluate musculoskeletal, muscle and joints and bones, neurological, nervous systems, mental or any kind of psychological issue need to evaluate. Lymphatic systems, hematology, blood and lymph, and endocrine systems. Now go for objective data. As I told you, objective data means observation, measurable, like vital sign. Physical, physical exam and laboratory data sections. Vital signs include oxygen saturation when indicated. Focus the physical exam. All laboratory data, X-ray, all is included to objective data. Also completed all the visit. Assessment problem list. Your assessment of the patient's problem. Assessment, a one sentence described of the patient's major problem. So problem list, a numerical list of problem identified. All listed problems need to be supported by findings in subjective and objective area above. Try to take the assessment of the measured problem to the highest level of diagnosis that you can. For example, low back pain caused by radiculitis involve the left fifth lumbar 5 nerve root. Provide at least 12 to differential diagnosis for the measure new problem identified by the note. So assessment, after finish the assessment, and assessment including subjective, objective data, we confirm the data collection and also communicate information received in the assessment. Then we go for diagnosis, and diagnosis we also called analysis. So diagnosis identify the actual or potential health care need and or problem based on your assessment. Interpret the data, then validate the data, organize and determine if there is a need for more data collections. In this phase, the nurse use data to formulate, and we call nursing diagnosis. Then go for plan. So you plan for the patient based on problem you have identified. Develop a diagnostic and treatment plan for each differential diagnosis. Your diagnostic plan may include test, procedure, or other laboratory studies or consultations. Your treatment plan should include patient education, pharmacotherapy, if any, or therapeutic procedure. You must also address the plan for follow-up. Planning, this is the done, provide the client care consistently, appropriately. So during the planning, we should ask ourselves or ask yourself few questions like, what are the priorities? Or how does this determine the client's needs? Or how will this affect the care the client is getting? And this is when the nurse determine the goals or formulate the outcome criteria, develops a plan of care, and collaborate with other healthcare professionals. And this is called interdisciplinary approach. After planning, we will go for implementation and evaluate. So implementation means to begin something or and then doing. So first of all, prepare, then counseling and teach, perform. After we should also perform, right? And keep the record and report. So let me explain one more time. We should prepare, means organize the client care, gather the equipment, and explain the procedure to the client. We counseling and teach the patients to direct at the client, their family members, or significant others, and also other member of the healthcare team. Also, we should follow the procedure, infection control, or we have to follow OSHA guidelines. Monitor the client response to care given. After care is performed, make the client comfortable, and then replace any equipment no longer needed. Also, record and report, document everything, accurately keeping record. The LPN report findings to RN, and RN report normally findings to the healthcare provider. After all of this, we have to evaluate about our services. So evaluation has been made, compared and expected outcome. We reevaluate the problem list with the rest of the healthcare team. So this is actually few talk or speech about the soap note, and I left some references from where I collected the informations.